Okay, so it's a day and a half of conference you've had, and if it was me, by now I'd be wondering whether I could slope off into Melbourne and do some shopping. So if you're probably close to switching off, so I'm going to give my take-home message first, which is, are there any students from general practice primary care nursing courses at Melbourne? No, then my message is completely wasted because I'm hoping to get some of them to do the survey for Advanced 2 that we're currently promoting. So if you do know anyone who was a student, please tell them, contact me. Okay, so Advanced 2 project, it's built on the SANS in GP, which was the Sustaining Advanced Nursing Development and Sustainability in General Practice, funded by the Australian Government and the AMLA. There were 5 teams consisting of primary care organisations and academic partners. There were a couple of universities involved, and they were looking at how to progress nurses to advanced levels in general practice. There were 5 different teams, and the one I'm looking at today is the team that looked at the individual nurse level. The other 4 levels, most of the information from the SANS project disappeared when AMLA's budget ended. That was in the middle of 2014. But if you go to the PICRIS website, you can actually find a presentation on this the other levels that were looked at. So the individual nurse level, there was a project called Advance, which was past and present students from the university from 2007 to 2012. And in that study, we found that 57% of the nurses were hospital trained, mean age of 46 and all female. And I just looked at the APNA workforce survey the other day. The mean age was 49, so it looks like we've all just stayed there and got older, I think, if that adds up. The reasons for studying nurses gave were to expand their scope of practice, improve clinical practice, increase work satisfaction, and increase autonomy. They weren't looking for pay rises, they were just looking for really professional reasons, and spoiler alert, it's a good job they went because they didn't get it. The enablers to practice was scholarship access, distance education, prior university experience, and support from colleagues. And the outcomes were people did get increased scope of practice, but interestingly, the job satisfaction didn't reach the increased scope of practice, and I wonder whether that's to do with the last 2. The increased respect from doctors didn't increase that much, and pay rates didn't increase. And this study, Advance 1, there's another recent study done on postgraduate nursing and midwifery education in Victoria. It's a 2015 report, and that's on Victorian Public Health Service. And they found the same kind of barriers, juggling family finances, and the structural issues there, such as no one to backfill positions, which was particularly important in rural areas, and lack of workplace support, like not rostering you on your day off so you could go to your clinical placements and your study. And their enablers were supportive workplace and flexible delivery of education, so pretty much the same as what was found in Advance 1. And the recommendations from Advance 1 was to increase the access to scholarships for education in primary care. And there used to be a scholarship that was just for primary care nurses that was run by APNA, and now it's all together with on the Australian College of Nursing website. So we're competing with all those other nurses. I don't know whether they have a certain amount set apart for general practice nurses. Alternative modes of delivery, which I'll talk a bit more about later, and development of policy that reflects the advanced educational levels and the role expansion, and also looking at increasing the extent of interprofessional collaboration which is a little, oh, this is good. I just had given a definition there of interprofessional collaboration, but it seems to have disappeared. It's more working on an even level with partners in the patient's care rather than the hierarchical structure of doctor, everybody else, nurse, right at the bottom. Oh, there's it must have got out of whack there. So why are we repeating the study? So we're really interested from an educational standpoint to see what's happening and follow up the changes from 2012. We know from APNA's 2015 workplace study there's 12,322 nurses working within general practice, and only 12.1% of those with formal postgraduate qualifications. And compare that to the acute sector, where there were 44.6 in 2009 with formal postgrad qualifications. So it'd be interesting to look at why that difference is. There have been some policy and practice changes. The introduction of the PNIP, that was just on its way in, I think, when they did the previous advanced study. See if that has increased nurses going into postgrad education. There's been a focus on nurse-led clinics. Last year there were 8 projects to set up nurse-led clinics, and there were, I think it was APNA had funding for nurse-led clinics earlier this year, and increased focus on management of chronic disease in primary care and Medicare reform. So what do we want to know in our study? We want to know who our students are. We want to see if it's the same mix. Just anecdotally, I seem to be seeing younger nurses in my groups than I have before, but we'll have to see what the figures show. We want to see what study outcomes, what does paying $20,000 for your postgrad diploma actually, what are the outcomes from that? How we can best respond to student needs. And we really want to hear their voice and hear what they would like. So the methodology, it's almost identical to the first study, and that's so we can compare the data. The collection methods have changed a little bit, and we've got different numbers. So in Advanced 1, there were 243 nurses. It was over a bit of a longer time. This time we've got 168, and 27 of those are actually current students at the moment. The collection method's a bit different. In 2012, we sent out a postcard first and then a paper-based survey. Now, I got a pile of papers on my desk about this big, and if I had a survey, it would probably be somewhere still sitting in there. There's probably still some of those sitting out there on people's desks, so we've gone digital. We used the alumni to send out an email to our past students. We did not have all the emails for students, only 74 private emails, and the 27 current students. So we've got about 60% of the cohort that we're able to actually contact. That's why I'm trying to get some more. The survey's been out now. The day after Anzac Day went out a week earlier to our current students, so I know that I had 9 of the current students had replied in the first week, which is 33%. But so far we've got 17 replies so far, and it's a 70% response rate in 2 weeks, and we're looking at we want a 40% response rate, otherwise the data won't mean anything. Analysis of what we've got so far. There's too few surveys to actually really present much of an analysis, but there do seem to be some emerging themes. So just some of the qualitative statements that we've got. There's a strong desire for nurses to progress practice nursing, so they're not really looking for pay rates and increasing their marketability, but really a desire to learn and a desire to progress general practice. Distance education in advance was seen as a major enabler, but we have had some not so positive responses about distance education, such as people preferring face-to-face and people wanting more webinars and more interactive. But I just did a course with nursing. There were 140 students. We had webinars twice a week, and the maximum number of students on those webinars was 24. So even if you do use technology, you're still not getting what people want from education. As far as a career pathway goes, people mentioned that they were disappointed there was no career pathway and outlined career pathway as being something they wanted. The work outcomes, a lot of comments about being able to establish nurse-led clinics. But this comment here at the bottom, I think, is very telling. My level of frustration with the system in which we work is now greater since studying. I know what I should and could be doing. That's other studies have shown that too. Would you recommend graduate study? And that's not just graduate study at Melbourne, but that's the whole package. Overwhelmingly positive responses. People do value postgraduate education. So what do we hope to achieve by doing Advanced 2? We'd like to see Commonwealth supported places but it's not going to happen. They're not really for postgraduate education and not at Melbourne University. I think South Australia might have some. Melbourne does have them for the nurse practitioner because it's entry to practice, and I think some of the other masters might have a Commonwealth supported place, but that's not going to happen. There may be the opportunity, the reason I was using the alumni to send out the surveys was to increase our contact with them because they may have some philanthropic scholarships in the future, and we may be able to tap into that and maybe get some primary care scholarships from that. Also looking at whether we could redesign the course, so instead of having 2 semesters, we would have 4 terms like school, which would mean instead of nurses who are working and busy trying to take 2 courses and all their assessments come together at the same time, which means it's going to take them, they'll have to do four subjects at once if they want to do full time, to do it over a year. They could actually do that over 2 years and just have 2 subjects at a time. It would mean, the negative I can see from that is having no break, so you have a very short break between your 170 hours of study, which each of our units is approximately. And we want to look at utilising web technology to create a more interactive experience for students, and also to make it easier for students who are not working in general practice, because a lot of our assessments are actually to create care plans for patients. Now, if you're not working in general practice, you can't do that, but we aim to video consultations so that they can actually do a care plan from watching someone else's consultation. They'll be actors, not real people, or real people but actors. So that was just my last thing, was to say, you know, please fill in the survey. Let me get to 40%. But there was one other thought that I wanted to leave, which is looking at the career and education framework. What's been found in studies is that the benefits of postgraduate education to the nurse are quite great. So increased self-confidence, self-esteem, knowledge, ability to apply critical thinking. But what I'd like to know, if we're going to say that advanced practice in general practice nurses is only when you've got a master's degree, which is what the framework suggests to me, is what evidence, or is there any evidence, that primary care nurses with postgraduate qualifications deliver better patient outcomes than your ordinary RN or EN? And I don't think that question's answered in the literature, and I don't know that we should be saying we need to be paying out $30,000 to be considered an advanced nurse in general practice. So, thank you.